Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and today I'm interviewing Rick Olderman, who is a physical therapist. I am asking him questions from our audience that you guys submitted about leg pain issues, including hip, knee, and ankle, and different foot issues. So, without further ado, here's Rick. All right, next question is from Carol H. The wording's a little different, but I think I can figure it all out. So, thoughts on hip replacements and structural problems developing. So, I believe Carol had a hip replacement already, by the way she's wording this. She's saying she has sciatica, knee stability, I'm presuming knee stability issues, arthritis on the top of the arch of the foot on the same side as the hip that required a second replacement. Is this a possible connection, and how to proceed in checking for a common thread?
Absolutely, there's a connection, and we kind of just went over that in the previous question too. So, you may have had a hip replacement. Well, prior to that hip replacement, the reason the hip may have broken down in the first place was because of that anterior femoral glide syndrome that I was just talking about. And why did the anterior femoral glide syndrome happen? Because of poor gluteal function or butt muscle function. And why did the muscle function? Why is that poor? Because of a gait pattern problem. All right. So if you had a hip replacement and now you're running into similar or the same problems, it means that you haven't solved the system's uh, problems that led to the original hip breakdown in the first place. So now the hip's not complaining because it's a brand new hip, it's metal, you don't have to worry about anything. But now your other areas are, because that was the compensating point. Now you've got other compensating points, and you've developed sciatica and other aches and pains throughout the system. Well, ultimately, it's going to go back to your gait pattern that you are likely locking your knees, and that is turning off the key gluteal muscles, which is setting up this whole system to fail. Because the butt muscles don't only control the tracking of the thigh bone, they control the rotation of the knee when you're walking. They control the orientation of the pelvis when you're standing and walking. And the pelvis then controls the low back system. All right. So, and then controlling the rotation of the thigh bone then controls the knee joint and what's going on there. And frankly, it also controls the foot and ankle joint too. So if the hip joint is uncontrolled, well, it's all linked together, just like the song. And so then the whole system is in flux. And especially if it's on the same side, well, it's already giving you your answer that you've got other problems that we need to solve here. So, and likely you have that side bending problem too as a consequence of this, and developing that side bending, because that's your brain's way of getting off this painful side. Your brain over time lifts that pelvis like that. Let's see if I can get that there. That might be it. So over time, your brain lifts that pelvis because it's like stepping on a sharp tack. Your brain's saying, hey, man, that hurts. I got to get off of that thing. So what it does is it hikes that pelvis up to get off of that painful area. Whatever area that is down the whole chain, your brain is trying to get off of that. And that's what's creating the side bending problem. Well, the muscles that lift the pelvis attach to the rib cage. So it's also going to pull the rib cage down, creating compression on that side of the spine and the roots of sciatic nerve pain. So you're absolutely correct. So what you need to do, I think, is find a therapist who understands things from more of a system and who will look at your whole lower body system to see what's going on here. Now, an easy gross test that you can do is find a chair or stool that you can sit on that you think you can stand up with one leg. Now, you can use your hand to balance when you're doing this if you want to. But so you lift up one leg up in the air, and then you stand up and sit down using a single leg, and then you switch legs. And you'll probably find that one of your legs is significantly weaker than the other, and it's usually the leg that's very painful. So this is telling you that you have asymmetries, significant asymmetries between the strength of your two legs. And so when you do strengthening exercises, you should be doing them unilaterally with each, one leg and then the other, so you can tease out what these strength differences are and pay attention to your gait. And all of my home programs, all the exercises are unilateral, so you'll discover exactly what the problems are. Now, another theme that may be contributing to this is that you could have a tension pattern throughout your whole body that's feeding into this whole problem. So what I mean by that is that we have fascia superhighways that run through our body from our head to our toes. Fascia is basically connective tissue. And so this connective tissue doesn't only include connective tissue, it includes everything that it envelops, which are muscles, ligaments, tendons, bones, nerves, blood vessels. I mean, uh, fascia holds together our visceral system. So fascia is the glue that holds the whole body together. And then there are these super highways of fascia that run through the body. So if you have been in pain for a long time and have been walking kind of incorrectly for a long time, it's likely that your body has developed tension around this whole system of movement. That tension pattern. So there's a super highway of fascia that runs down the back from the head to the toes. There's one that runs down the side from the head to the toes. There's a couple that run down the front. There's a spiral one that spirals up the body. And so I have found what's helpful are somatic. I've created some somatics audio lessons that help you unlock all these tension patterns from your body. And a lot of people who have chronic pain, this is the beginning of them solving their chronic pain. Because if we can unlock everything first, then you can get everything to work better. And that's what I usually counsel most people to do, is to unlock their systems first and then start fixing the systems. And so, sorry, that was a long question to a long answer to a short question, but you're very astute in your observation that, hey, is this whole thing connected? Absolutely, it's connected, and there are many connections, but you're on the right track. There are asymmetries in your lower body system that are at the root of all of these, and your walking pattern is one of the biggest problems.
Do you want to talk about an easy way to not lock your knees when you walk?
Oh, sure. Yeah. So the easiest way. So uh, first of all, let's talk about what I'm talking about when I say lock your knees. So if you're watching this video, just stand up for a second, and you'll notice that if you stand for more than a minute or two, your knees are locked backwards in a straightened position. This is an energy conservation move that we do to conserve energy, because now we get to stand on our joints instead of using our leg muscles to do this. All right. However, this has consequences. One of the consequences I mentioned was it turns off those ever important gluteal muscles in the back of your hip. You'll also notice that if you're locking your knees and you unlock them and then you lock them again, you'll notice that your back also arches more when you lock your knees. And if you have back or sciatic pain, this is one of the root causes of that back and sciatic pain. So unlocking the knees will help solve back, sciatic, hip, knee, and foot issues for all of these reasons. It helps turn on muscles that are supposed to be turned on, and it balances the two sides of your body too. So what, now that you understand what I'm talking about with locking the knees and unlocking the knees, and there are repercussions throughout the body with this behavior. So an easy way that I do is I put a little piece of tape on the backs of my patients' knees, and when they're soft, and then when they lock their knees, they get that instant feedback from the tape that tells them that they're locking their knees. And so then they get, I've got to unlock that. And that is hugely helpful, because this is an unconscious movement habit that your brain will not recognize and pay attention to for you, because you've already trained your brain to make this your normal way of moving. So your brain will really only be alerted to the idea that you're unlocking your knees. If you lock your knees, your brain's going to shut down and say all of those alert systems and say, I'm back to where you taught me to be, right? So sometimes you need a little bit of helper, and tape can help that, help you unlock your knees. And I mean, invariably, people with back, hip, or sciatic pain whose root causes are knee locking, when I unlock their knees, usually in about 3 days, most people's pain is like 30 to 70% reduced just by unlocking their knees. And if that's the case, it tells you you're on the right track of solving a systems problem that's feeding a lot of your pain.